Welcome to Health and Wellness. I'm Dr. Jennifer Ashton. Today we're talking about dangerous drug interactions and some of the common over-the-counter medications and supplements that can cause them. So we're joined today by clinical pharmacist Dana Bland. Thanks so much for joining us, Dana.
Thank you for having me.
So let's start. You're the expert in any drug that we can get either by prescription or over-the-counter. Today I really want to focus mainly on the over-the-counter variety because a lot of people think if you can get something without a prescription, it must be safe.
Right.
What do you think the biggest dangers are lurking in most of our homes that pertain to over-the-counter medication? Right?
People need to know that they can have drug interactions when they take over-the-counter medications or dietary supplements with their existing medications. Things like pain relievers, Tylenol. People need to be aware that it comes in different formulations.
Acetaminophen, which is the generic name for Tylenol, is implicated in, it's the #1 cause of acute liver failure in this country, and it can really interact, as you say, with not only other medications but with alcohol, even social alcohol consumption. What are some of the hidden sources of Tylenol or acetaminophen over the counter?
Right. Well, first off, a lot of combination products. Nowadays, you'll see a major heading of Tylenol, cold and cough. What you have to make sure that you do nowadays is, turn the box over, read the label. That's a very important thing, to look at the active ingredients, because oftentimes these combination products will have Tylenol, which is a relatively benign medication, but as you said, can be, toxic to your liver if it's taken in too high a dose. But they also have decongestants in them that, may be a flag for people with hypertension, high blood pressure. Also, people that have diabetes need to be aware of certain medications that may, alter their blood sugar levels.
Right. So, and this is just talking about things that are in the pain aisle, if you will, in the drugstore. So Tylenol, things called non-steroidal anti-inflammatories, ibuprofen, Advil, and Motrin can increase bleeding risk, and a lot of people on blood thinners could interact with that as well, right?
Absolutely.
Let's talk about kids for a second. What's the most important thing you think for parents to know about over-the-counter medications in kids? I would guess it would be related to dose, right?
Absolutely. We often think that kids are little mini-me's of us, and in ways they are, but when it comes to medications, they're not. Oftentimes, their dose is based on body weight.
Sure. So you should check this online, check with your pediatrician and your pharmacist, because the dosing is very, very important.
Absolutely.
One thing that is very close to my heart because of my specialty as a gynecologist is menstrual relievers, pain relievers. And I hear time and time again, especially from teenagers, that they walk down the aisle and because of the nice advertising and marketing, they pick up a product that's marketed for menstrual period pain, and they say, well, guess what, it doesn't work. And I say, not surprising, because it's based with Tylenol, and we know that ibuprofen is really the gold standard for treating menstrual cramps, and a lot of the menstrual products also have a stimulant or a diuretic, or some of them have Benadryl, which is a sedative. So I think that your point about reading the label and actually then going to a pharmacist or the internet and looking up what those ingredients are and what they do can be important, because a lot of times you're not even aware what you're taking, and you might, in the effort to self-medicate and self-treat, actually be misdiagnosing.
Exactly.
We're going to take a quick break for a word from our sponsor, and we'll be back with more drug tips from clinical pharmacist Dana Bland after the break. Now let's talk about a common question. We hear about this occasionally on TV or in magazines. When should you throw out your medications, and how should you dispose of them? Because that's also a big thing. Some people just dump them down the toilet, but that might not be so good because it gets into the water supply.
Exactly.
So first, expiration dates.
The expiration date is typically the date that the manufacturer is comfortable with saying that it's still safe and effective. And
is it a toxicity issue, or is it just an efficacy issue?
Primarily, I would say, is probably the safety issue or toxicity. Because as the medications break down, they actually can form some metabolites or inactive ingredients that,
or byproducts,
exactly, that your body may not respond to well. And so, like I said, the manufacturer is comfortable up to that date on the box saying, yes, this drug is safe and effective.
Now, what about how should we get rid of them?
Typically, I don't think it's a good idea to kind of just toss medications in the garbage. You never know who, may open the bag and kind of get exposed to it. And, flushing them down the toilet or the sink, again, you know, you really want to maybe reach out to your pharmacist and kind of
Right.
just ask them, because each medication is different.
Let's talk a little bit now about herbal supplements.
Mm-hmm.
Now, alternative medicine is huge in this country, as you know. People
Yes.
spend billions and billions of dollars on it. Once again, they think, oh, if it's an herb, it's natural, it must be safe,
Mm-hmm.
to which, I don't know if you've heard me say this ever, I say, well, cocaine is a plant, marijuana is a plant, digitalis is a plant, which is one of the strongest heart medications. All of these plants are natural.
Exactly.
Obviously, they can be very dangerous, so don't always assume that because something's an herb, it's so safe. What do you think are the safest herbs, if you can tell us, Dana, and what are the most dangerous ones?
Well, you know what, that's going to kind of vary depending on the person. For example, garlic, you know, that's touted to have effects on, you know, blood
Bleeding,
pressure,
right.
you know, cardiovascular health. But you have to be careful because, you know, if you're already on an existing blood pressure medication
Right.
and you say, okay, well, I'm going to take garlic just to kind of, you know, give me that extra, it could actually, you know, cause your existing prescription blood pressure medication to work, for lack of a better word, even better, to
Right.
make that lowering of your blood
Right.
pressure even more severe, which can lead to complications.
Sure.
So, you know, it's a case by case. Each, you know, patient scenario is a little bit different. It's always good when you're at your doctor and your pharmacist to let them know, because a lot of people forget. You know, I forget the dietary
That's
supplements.
right.
I'm just focused on the
Or they forget the
prescription.
vitamins, they forget the herbs and all of that.
Absolutely. And so, you know, it's going to depend.
What about a trend we've been hearing more and more about recently, Dana, about people buying their medication, even prescription medication now, online? Oftentimes it's from another country. What do people need to know about that? That seems to me a very risky, iffy practice.
I would agree. I know that there's a lot of issues out there as far as
Right.
cost of medications
Sure.
nowadays, when people are like, oh, I can get it cheaper online or from another country. But the risk that you run is, well, what type of quality control checks
Sure.
are these other countries doing? Are you really getting what they say that you're getting? I wouldn't recommend it.
A lot of doctors are familiar with just the brand name, because when a drug oftentimes comes to market, it's patented, and so it comes only in brand name. And then only after years will it go generic.
Right.
In certain cases. A lot of patients are afraid of the generic. What's your opinion from a pharmacist perspective?
I would say the majority of times the generic is just as good. One thing that you want to keep in mind, though, for the inactive ingredients, sometimes people may have sensitivity to those, and that isn't necessarily the same across a brand versus a generic.
Well, Dana, thank you so much for joining us.
Thank you for having
my
me.
thanks again to clinical pharmacist Dana Bland, and thank you for joining us for another episode of Health and Wellness. I'm Dr. Jennifer Ashton. Until next time, wishing you good health.